Hello everyone, welcome back to my channel. If you are new here, I am a public health professional and on this channel we talk all things health. Today's hot topic is public health, gaining a basic understanding of what public health is. Now, before we get to what public health is, I wanted us to have a basic understanding of what health is first. Now, some of you might find definitions boring, and some of them really are, but stick with me on this one. The WHO defines health as a state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. Although I find this definition to be very self-explanatory, I want to highlight my liking for this definition because of the three factors of physical, mental, and social well-being that it touches on. It's very typical and traditional of us to think of health as physical health, how we're feeling physically. However, health is so much more than that. There's so many other factors that go into determining your health that fall under these three domains, and that's exactly why we're going to be touching upon topics that touch these domains in future videos. Now, moving on to what public health actually is. So here's the literal definition of public health. Although you folks are free to go back and read on it, we don't have 10 minutes to finish reading that definition. So here's a simpler explanation of what public health is. So whenever you go to a doctor to treat a condition or a disease, that's a one-on-one doctor-patient interaction happening on an individual level. However, in public health, we deal with health on a population or community level. It focuses on protecting community health with an emphasis on prevention rather than cure. Sure, cure is a part of public health, but your traditional medicine typically wouldn't emphasize on prevention, and that's what I wanted to highlight on this. It's literally in the name, dealing with health on a public level. So why is public health important and why should we care about it? I think to answer this question, being in the middle of a pandemic serves as a great example. Imagine this. You have this deadly virus hovering around us like there's free Pani Puri samples being distributed everywhere, which, by the way, if you don't know, Google it. You need to know. And you only have doctors, nurses, and pharmacists to take care of it, and that's it. Imagine how much more the hospitals would be overwhelmed than they already are, how strenuous it would be for our healthcare system, and how much longer it would take for this pandemic to be over. Of course, it's not over yet, but even the vision of the end point would be much further away without the concept of public health and public health professionals. Without public health, you wouldn't have all of these vaccination initiatives that are encouraging people to take a step forward towards prevention rather than cure. You wouldn't have these massive systems set up that are aiming to prevent the disease from reaching large groups of people. And you wouldn't even see health promotion to a scale that you've experienced so far that encourage you to wash your hands regularly, to stay 6 feet apart, to stay at home when feeling sick, and other things like that that are going to prevent you and people around you from contracting this virus. Of course, there's no one or easy way to answer this question. And you'll understand more as and when we dive into these various topics of public health. But I hope this little explanation and example helps to get the ball rolling in your mind and start seeing a side of healthcare from a different and untraditional perspective. Last but not the least for this video, what do public health professionals do? I think I get this question asked almost on a monthly basis. What is it that you people do? We basically assess, analyze, and implement. We assess a healthcare problem in the community. We analyze strategies for prevention and treatment. And we implement these strategies through programs and initiatives for a positive change. So, for example, many current public health professionals are working towards and employing strategies to mitigate the diabetes and obesity epidemic in the US. They're also working towards employing policies around smoking to reduce lung cancer and also exposure to secondhand smoking. There are also programs to reduce air pollution, to improve access to water and clean water and sanitation, to raise awareness about the effects of drugs and alcohol to prevent addiction, crafting nutrition programs in schools to encourage healthy eating in children, and many more programs and initiatives and awareness drives that fall under a broad arena of topics that fall under the 3 domains of health that I talked about earlier. So that is it for today's video. I do understand that this could be overwhelming and a lot of information to digest, especially for all you folks out there who've never heard of any of this before. So do take some time and reflect on it, and we will be diving more into all of these things in future videos. Moving on to the most exciting part of the video, our quote for the day. So today we have, "Nothing will work unless you do." Thanks again for joining, and if you liked this video and found anything valuable, do consider liking and subscribing to the channel and not missing any further videos. I'll see you in my next video. Bye-bye.